Tēnā koutou, welcome to the third module in this series on understanding bias in healthcare. This module looks at consumers and clinicians' real-life experiences of bias, both implicit and explicit.
The journey to providing culturally safe care for Māori is a rewarding journey that takes very little effort to start using a small amount of te reo, understanding other people's worldviews, understanding the difference between equity and equality, and to those that say I treat everyone equally, there are people that aren't on equal footing, understanding your privilege that you have and that other people don't necessarily have that privilege, and just the connection that you can make with patients across all different areas, being aware of your biases and realising that there are many other people there that have a different worldview to you will actually improve the care you provide to all patients, not just Māori.
Yes. I believe I am treated differently because I'm not Pākehā. And for this particular incident that happened to me, is still very raw, and I can still, when I reflect on it, the experience was horrendous, and it's a situation that is very critical, and it impacts on your life, and yet I believe that I did not receive the comprehensive advice from the clinician in terms of my care and in terms of the course of action that was prescribed for me to take. I only go to Pacific doctors now, or clinicians. That has been a conscious decision on my part and that of my family in Fanau, primarily because, one, I feel the confidence that they are able to sit and take time to hear me out, to talk about my condition. There's the cultural aspect because they know who I am and where I've come from, and they've taken the time to listen. And there's it's like a family atmosphere that is created in this clinic. Some of the things that Pākehā doctors could do is as basic as giving a little bit more time, ensuring that the person before them is not just any person, that they must show some compassion when dealing with people, particularly of Pasifika cultures. The Pacific people, when we engage, your initial contact is very important. It's how we would, if you come out and meet and greet the patient and you're smiling and you look that you're wanting to engage, so immediately we respond. We know that you care, you know.
Being Samoan, and I was born in Invercargill, and I was raised up Samoan, but you go out leaving, being educated and socialising in a very white environment. My name, my maiden name is Tono Mai Pea. There is a legend behind this name, and for a lot of people, it was very hard for them to pronounce. And so they shortened it to Pea. So what I recognised is that unconsciously they were shortening a name to suit them. And I know that wasn't intentional, but when you shorten someone's name, and they shortened it to Pea, and Pea means bat in Samoan, and it totally gives a different meaning to a name that has a lot of legacy to it, a lot of sacredness to it, and it can sort of take someone's identity away. The health system is structured in a way where sometimes it's not so friendly towards our Pacific community. I think a lot of clinicians are very busy, and taking time out to engage with our Pacific people can take a big toll on them. but making this a priority in their practice can make a big difference in the long term of engaging with Pacific people and gaining better health outcomes. So some of the simple things that I could recommend for our clinicians is to pronounce names, make an effort to learn the Pacific vowels, make an effort to pronounce the names well, and this really helps. It lifts a person knowing that someone's made an effort to get to know their name or even pronounce the name. And I think one of the other tips that I'd also suggest is to do some is ask questions. Ask questions to the Pacific patient and gain clarity what's important to them, what's their values.
So when you're working, focus on your breathing. Slow down your breathing. Exhale bias brain and inhale mindful brain. Now you've watched this module, we invite you to make this just the start of your learning about bias in healthcare. To find out more, make sure you have watched the other 2 modules in this series of 3 and see the Health Quality and Safety Commission's website for further information. Kia ora tātou.
Unu hea, unu hea, unu hea to uru tapanui. Kia māma, kia wāte, ta ngātau, te hiningaro, te wairua, i ta ara takatū. Koirā I rongo, whakairia ki ronga, ai rā, ko wātea. Haumie, hui e, tā ki e.